You know, always time we talk to folks in the medical community today. Dr. Taravath here from the, I want to get this right, the Nunnelee Pediatric Specialty Clinics at New Hanover Regional Medical Center. We're going to talk about epilepsy, which we were saying affects both children and adults as well. When it affects children, will they be born with this? Does it come later in childhood?
Epilepsy can start any time of your life. Actually, we see two distinct peaks. One is early childhood, the other one is later in life. So it can be at birth, it can be any time during your life can start.
And I know that, you know, one of the misconceptions with epilepsy is people will look at it and think there's going to be a lifelong struggle, but this is really something that people can deal with and lead a very productive life.
Absolutely, because if you look at the epilepsy, the prevalence of epilepsy is about 2% all over the world. And most people with epilepsy have productive lives. And the idea that epilepsy is handicapping, it's true to a certain extent, but it cannot be disabling. That's what we want to do. We treat them so they can be productive.
I don't want to just do specifically with children, but across the board, what are some of the early signs where you might think, I might want to have this checked out?
Any child or any adult who have alteration of consciousness, that means any impairment of consciousness or convulsions, one should go to somebody who knows about epilepsy.
You know, most often people associate seizures with epilepsy, and again, you know, when this happens, I know when I was a child and you heard this, I was told, right, make sure you get something in somebody's mouth, and that's what we know now you don't want to do.
Yes, I'm glad you brought it up, because first aid of epilepsy, one of the biggest misconceptions is that you swallow your tongue.
Yeah.
It never happens. You don't need to put anything in your mouth, but you must protect their airway, want to make sure that they are not injured, they're breathing properly. That's what you need to do.
Give them the space, and again, whenever you know, call 911. It's the best thing you can do in this situation or any emergency situation. Dr. Taravath, I appreciate the time this morning.
Thank you.
It always flies.
Thank you.
We're back with more after this.